The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Elbow Pain by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In this video, we will be discussing elbow pain, what it is, what causes elbow pain, and what are some treatment recommendations. We will give you some home diagnostic tools that you can use to help self-diagnose where your elbow pain is coming from, as well as some simple home treatment remedies that can be tried to perhaps save you that initial doctor's office visit. So first of all, what is elbow pain? Obviously, this is a very broad topic, and so we're just going to scratch the surface of some of the reasons that patients develop elbow pain. For more detail, please see the individual videos for the different elbow topics. In general, there are really just a few things that cause elbow pain. The most common of which everyone has heard of is tennis elbow. Lateral epicondylitis is the medical term for this. This tends to occur on the outside of the elbow. It tends to be associated with repetitive or overuse. I see this in patients from their teens all the way up into their 60s. It's usually something that comes about slowly, without a history of an acute injury or trauma. And again, oftentimes it's associated with repetitive motions, such as a new workout routine or a repetitive job, such as a machinist or a carpenter or a plumber or something like that. The opposite of lateral epicondylitis is medial epicondylitis or golfer's elbow. Essentially, the pathology is the same. Both of these are tendinopathies, and again, this is usually associated with an overuse syndrome and something that comes about relatively slowly. Something else that can cause pain in the elbow is irritation of the ulnar nerve in the back of the elbow. That's just behind the medial epicondyle, or the most prominent bone on the medial side or the inside of the elbow. If you follow your fingers just behind that, you fall into a groove. This is the funny bone nerve, or the ulnar nerve. If that nerve is irritated, this is something called cubital tunnel syndrome. Not only can that cause some pain in the elbow, more commonly, however, it presents with numbness and tingling down into this part of the hand. So the small and the ring finger, and sometimes the ulnar side of the forearm. But oftentimes patients will have some isolated elbow pain as well. Occasionally the triceps tendon here can develop tendinitis and become painful. Occasionally overlying the tip of the elbow, patients can develop what's called olecranon bursitis. Sometimes this is painful, sometimes it's not. Most often it's associated with a large swollen area. It looks like a golf ball or sometimes even a tennis ball over the tip of the elbow. Most of the time, this is not infected. However, occasionally we'll see an infected olecranon bursitis, in which case that can be quite painful. And occasionally, on the opposite side, patients can develop a biceps tendinitis, or a biceps rupture. Obviously would be a traumatic event, and patients would have some other signs and symptoms such as swelling and bruising, and usually they feel or hear a pop. Ligaments on the inside and outside, the collateral ligaments of the elbow, again, those can be injured or damaged with traumatic events or sometimes overuse, such as pitchers. They'll stretch out the medial collateral ligament of their elbow. That can cause some pain. And then, of course, there's arthritis. So there's several things that can cause elbow pain. We're going to really focus in on a few of the most commons, and then again get into more detail in some of the other videos. So what are some simple diagnostic tools that you can do to help narrow your focus of what is the potential pain generator in your elbow? Really try to pinpoint exactly where the pain is. So really try to drill down to where is it. Oftentimes patients will come see me in the office and they'll say, well, you know, my elbow, it just hurts everywhere. But when we really have them narrow their focus and really pinpoint where the pain is, usually they can isolate it to the lateral aspect of the elbow or the medial aspect or the posterior aspect or the anterior aspect of the elbow. See if there's any other associated symptoms such as numbness and tingling into the forearm or hand. See if there's any popping or clicking or catching in the elbow. Occasionally tendons can snap and pop. Occasionally some instability of the elbow can cause that. With arthritis, if there's any bone spurs or little loose pieces of bone, loose bodies in the elbow, occasionally patients will feel some clicking or grinding or catching in the elbow. Look for range of motion of the elbow. Patients should normally have full range of motion of the elbow. As the elbow becomes arthritic, oftentimes that range of motion will become more and more limited. So these are some simple things that you can do to really focus in on what your source of pain is. And then when patients come to see me in the office, there are other diagnostic tools, obviously, that we can use, such as X-ray to look at the bony alignment. We can check for arthritis. We can check for bone spurs or loose bodies within the elbow.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.